now. All right, welcome, Alexa. Thank you so much for doing this career chat with us today. So you are a nurse, you're a registered nurse, is that correct?
Yes.
But more specifically, you are a postpartum nurse. Can you tell us what that means?
Yeah, so postpartum nursing, it is basically I take care of the moms and their babies after they deliver. So I'm not there in the delivery. I take over and I help them recover afterwards, and help provide a lot of education and basically give them the confidence and preparation they need to go home and be able to take care of their babies once they get home.
That's great. Okay, well, let's start with the basics. So can you tell us a little bit about your years in the workforce, a little bit about growing up, your college experience, and how you, started?
Yes, I went for my nursing school. I went to Mid America Nazarene, which is actually in Kansas, although I'm California born and bred. Um, so I'll kind of tell a little bit later about that journey, how I got out there. But I have been a nurse for 7 years, and I've actually been in my current job since I graduated nursing school. So I've been there 7 years, which is in Fresno. It's a hospital called Community Regional. So it's a large hospital. We actually, in a lot of places, you'll have a combination of labor and delivery and postpartum nurses where you kind of may have your same nurse the whole time. But our unit is so large, we actually have a separate labor and delivery and postpartum. So my unit has 45 beds just on its own. So you can kind of give you an idea of how big it is.
How many beds do you have full at any one time?
Typically, we're running between 20 and 30. It just kind of depends on the season. So because postpartum moms don't stay very long, anywhere from 1 to 4 days, we will fluctuate and have a ton of little deliveries, and then 2 days later they're all gone. So it definitely is busier during the week than the weekend. So it just fluctuates.
Great. And you wanted to be a veterinarian when you were a child and then transition. How did you change fields from your childhood dream to adulthood?
Honestly, I thought being a veterinarian meant that I got to play with puppies and kittens all day. Um, so once I realized I don't like seeing animals in pain, that wasn't ever fully realistic. My husband and I always joked about opening up a vet clinic ourselves, but definitely had a unrealistic view of what that would be.
Got it. Okay, well, let's go a little bit further. So can you talk a little bit about the basics? What does the regular workday look like for you? What does it look like on a daily basis to be a nurse?
So for me, I am currently a night shift nurse, and I've done that my whole career. So I work 12-hour shifts, 3 days a week. So I start my night at 7 p.m. and I work until 7:30 in the morning. And so when I get off on shift, we typically have a little meeting right at the beginning just to kind of go over any new policy changes. And then we head out to the unit and we get our assignment. The day shift nurse is usually eagerly waiting for us to give us a report. And from there, I look over my doctor's orders, kind of develop a plan for the night, go and see all my patients. And the next 12 hours is basically checking off a bunch of different tasks and rounding, providing education, answering questions, making sure everyone's medically stable, and that we're moving towards discharge. And then in the morning, the day shift nurse shows up and I give her a report and I head on home.
How many mothers and babies do you have on your rotation on a given night, like that you specifically are responsible for?
So typically we call a mom and a baby unit a tuplet. And so typically I'll have 3 to 4 tuplets. So anywhere from 6 to 8 patients. Obviously, if a mom has twins, that kind of changes things a little bit. I might have a mom whose baby's in NICU and then a mom with twins, just kind of balance things out. But I'm looking at anywhere from 3 to 4 tuplets.
Got it. Okay. And what sort of things do you have to do throughout the night? You said that you do medication and education. What does it look like in terms of working with the moms, especially in the night shift?
So for a mom, I'll initially start with an assessment. So basically I'm moving from head to toe. I'm listening to her heart and her lungs, her stomach. I'm asking her if she's farting, if she's pooping, peeing, all these funny questions. For a mom after delivery, we do something called a fundal assessment. So I'm checking where her uterus is just by feeling on her stomach, checking for swelling, asking her about pain. If she's a C-section, I'm obviously looking at her incision. I'm working on getting her up and moving. There's a couple extra things as far as like a post-surgery patient versus a post-vaginal birth. And then, yeah, she'll have meditations. I'll be doing her vital signs. Usually kind of the beginning is the busy part, doing a lot of that. And then after that, for a mom, it's more just pain management, making sure she's drinking lots of fluids. For her baby, I'm doing also an assessment where I'm doing temperature, heart rate, respirations. I'm looking over the baby as far as like head to toe, just looking for any skin abrasions from delivery or anything like that. I'm making sure that the bands on the baby match up with the mom, that we have the right people in the right room together. Doing baby baths, weights, lab draws. Yeah, it can just range the whole gamut based on
Oh, that's great. We
how
like specific so we can kind of hear the details of what it actually like entails, right?
Yeah.
Cool. So can you talk a little bit about what inspired you to become a nurse?
My inspiration, I've always loved just helping people. That's my natural personality, and that's definitely key to being a nurse. I'd say the second thing is I loved medical shows. Anything like Untold Stories of the ER. Later on, it was Grey's Anatomy, stuff
Oh
like
yeah.
that. I loved medical shows. And so I just wasn't ever sure, like, okay, obviously I'm seeing on TV. Can I actually do this in real life? And but that was definitely an inspiration for sure.
Did you know when you went did you start college knowing like you went straight to nursing school, or did you go to college first and then decide, okay, I've graduated, I have a bachelor's degree, and now I'm going to go become a nurse? How did that start?
Yes, I didn't know. I knew my interest was leaning more towards medical. Obviously, the medical field is massive. So you
Yeah.
can know like medical school, nursing, therapy, physical therapy, occupational therapy. There's so many different ways to go. So I wasn't sure exactly. I started out with junior college and was doing just kind of my basic classes. I was on the pre-nursing route. So I was doing anatomy, physiology, some of those prerequisites that I knew I would need later on somewhere in the medical field.
Mhm.
And then while I was at junior college, I was kind of like, okay, I think I want to go this way, but I wasn't sure. So I actually did an EMT class, and it
Oh,
was in the evening, for a semester, and I loved it. I loved learning just all of the emergency medical stuff. We got to go on ambulance ride-alongs. And so that was definitely, I was like, okay, I can handle this. Like it's more than just the medical show love. And so I definitely, I got my EMT license. I never really worked as an EMT. I kind of did it a little bit while I was in college later on. I was in a small town, so I kind of was just on call a couple times. So I never really worked in that area, but it definitely gave me more confidence to keep moving forward in that direction.
that's great. So then you did that while you were in community college, and then how did you decide to choose a school so far from home?
Yeah, so my next college journey step was not probably not very fluid as far as like following a direct path into nursing. I ended up going to a school called Tabor in Kansas, and the school itself is more education focused and not nursing at all. So they actually don't have a nursing program. But I was still trying to kind of hammer out like, do I go medicine, nursing? And so while I was there, I kind of continued taking classes to move towards something in the medical field. And by the time I was a senior, I really narrowed down like, okay, I do want to do nursing. Here's the problem. I'm at a school that does not have that. And I'm so close to graduating. Like, what degree can I get that would just kind of go along with that? So I ended up graduating with a degree in social sciences and psychology. And so it definitely was not direct. So from there, I ended up coming back to California. I was here about 8 months, and then I applied to some schools here. But the problem was I was already in college for 4 years. I have loans underneath me. I'm like, I don't want to spend another however many years needed to get a nursing degree. I'm ready to be like working. And there was one program back in Kansas that was an accelerated BSN. And it was a 1-year program that it's basically meant for people who are in a current career and they want to fast track into a career in nursing. So either you had a previous bachelor's degree in something, you were working in something else. So it wasn't your typical college age kids. It was definitely people who were older. And I applied there and ended up getting in and 1 year had my bachelor's in nursing, which was awesome. And
Yeah, that's great.
could start working from there.
And then you moved back home and
Mhm.
started at, did you say Fresno Community?
Yeah. Mhm.
Awesome. Okay.
Yeah.
And so how did you apply for that job? How long did it take you? 'Cause you said this is where you've been for the last 7 years. This is home for you, right? You love the night shift. You told me you love the night shift.
Yeah.
How did you get the job, and what did it take to get the job?
So when I was close to graduating, I knew that for nursing, you take the national boards, you take the NCLEX to be certified, but then you still have to pay attention to state requirements as far as what each state needs. So I knew that I was going to be coming back to California. So I made sure I met those requirements, which my schooling did. And also that I applied for my boards in California. My job is actually one of those, someone, I didn't know my manager. Turns out I had gone to high school with her son, but we had a mutual friend who happened to mention my name to her. And I had done my senior rotation in nursing school in the NICU. So I knew that I wanted to be somewhere in the field with babies. And so it was just totally a great thing of just knowing someone. So I went and interviewed and got the job actually before I had taken my national exam, and it was all contingent upon me passing. And luckily I did.
Nice. So can you talk, oh, we have a question in the chat. I think it's to you. How much coffee do you drink? I assume,
So,
Alex, it's because of the night shift. Yes, because of the night shift. How much coffee do you drink?
surprisingly, I am not a daily coffee drinker. Usually what I'll do, so it depends. If I am working, by the time I actually sit down to have a cup of coffee, it might be 1 or 2 in the morning. And then I have to decide, okay, do I want to get hyped up on caffeine now? And then I won't be able to sleep once I get off work. So it's usually the if I get it early enough in the night, I'll definitely have a cup. A lot of times what I do, because I do live over an hour from my hospital, is I will grab coffee for my drive home. So that's usually when I get the coffee.
Got it. Okay. Yeah. So going a little bit, I want to hear more about like the boards and what it takes to get licensed after, because, we learned yesterday, we talked with a licensed clinical social worker yesterday, and she told us it took her 8 years because it wasn't just getting a master's degree in social work. It was, she had to do so many hours while getting that. And then after that, she had to do like 3,200 hours of working with clients before she could like apply for her license. Then she had to take a test. So I do want to hear, let's talk about that and then go back to the night shift. What you mentioned the boards. So first you get the bachelor's degree in nursing.
And you don't have to, you can get an associate's degree in nursing. I will say most programs are wanting to move towards the bachelor's. They can get magnet status, which means that they have a certain number, a hospital can get magnet status, meaning they have a certain percentage that are bachelor certified nurses. But you can get an associate's degree in nursing.
Can you talk about the differences and the qualification, or like what is the difference between having an AA in nursing versus a BA in nursing? And does it give you extra qualifications, more pay, better understanding of certain jobs within the field?
I think definitely a bachelor's is more appealing to an employer. but they also, I mean, I worked with several nurses who were associate degree nurses, and then you can actually do a bridge program to get your bachelor's. And even our hospital is helping provide education funding for that for people who are interested. So it's definitely not a turnoff to be just an associate's. And that's a little bit of a faster track. I want to say it's maybe 3 years, and you can do it junior college. You can accomplish that. And then, yeah, bachelor's. The good thing about that is you can bridge pretty easily to a master's, get your master's in 2 years, which then allows you to be a nurse practitioner, or do different areas in that field. Once you graduate school, you can sit for your exam. It's not like you have to go and get an externship and put in a bunch of hours before you can apply for the national boards. You can go, once you have graduated nursing school, you can sit for your boards.
Got it.
That's
Excellent.
the difference.
And then you're qualified and you can start working.
Yep.
Excellent.
Yeah, it's just difference between like some states. So if you're doing travel nursing, you would just have to make sure that your qualifications met for whatever state you're going to. And California is pretty much the most prestigious. So if you're good in California, you're probably good for every other state.
That's typically how it works for most fields, right? If the baseline is here, California always
Yeah.
likes to take it to the next level,
Yes.
which is not bad, right? It allows Californians to go anywhere they want to go after they get the qualification. So, okay, let's go on. We kind of talked about this. Is there anything on here? These are can you go a little bit more in detail with anything of your job duties that you think we might not have hit before?
Yeah, so one thing would be coordinating with members of the care team. And a lot of this does happen more on day shift, I'll be honest, than night shift. But as a nurse, you are coordinating between not only the mom's doctor, the OB doctor, you're dealing with the pediatrician, you're dealing with possibly social work or CPS involvement, dietary, case management. You have lactation consultants helping with breastfeeding. Meanwhile, also staying updated with your current manager and supervisors. So you really, as the nurse, you're the one who's in there every hour, every 2 hours, talking with mom face to face. So you really are her voice as far as dealing with a lot of the members of the care team, because the doctors will pop in once a day and maybe stay for 5 or 10 minutes and then they're gone and doing other stuff. So as the nurse, you really are that face and that voice for your patients. And then charting, that is a big one. There's a phrase in nursing where if you don't document it, it wasn't done. And so that is definitely one of the things that just rests on our head all the time, is just making sure that we've documented everything. And you do your best. You can't, sometimes the night is just so busy and you can document what you can document, but you definitely want to, with critical stuff, doctor notifications, be documenting all of that. And then in my night, I mean, I can be doing a late discharge where I'm sending someone home and then there's someone rolling through the door from labor and delivery. So there's just a lot of turnover as far as admissions and discharges, and just making sure everything's been done for those.
Awesome.
Yeah.
I remember from a Grey's Anatomy episode, I think that like the nurse is the patient advocate. And does that mean if the doctor is suggesting or prescribing something, like you do have a responsibility because you're around the patient more? What happens when you disagree with a doctor or you have information that you think, the doctor's giving an order that you think is not in the mother's or baby's best interest? Does that happen?
Yeah, definitely. It can be something where the doctor will come in and discuss something, and then I come in like a few minutes later and she's like, hey, I'm not sure about this. And I mean, especially with like breastfeeding, it happens a lot where the doctor may prescribe an antidepressant or something because she has a history of depression, and turns out that's not safe for the baby through the breast milk. And so yeah, for us, it's just then basically a phone call like, hey, the mom's concerned about this medication. Is there something different that we can give her? Or hey, lactation is advising against giving this because mom is breastfeeding. And the doctors are usually very receptive to having an alternative or something else like that. I just remind my moms, I'm like, you have the right to refuse anything, that is your patient right. And then my job is just to communicate that and let the doctor know, and they can come back and talk to the mom again. Um, we deal with situations where maybe culturally someone doesn't want a blood transfusion and they really are in a situation where we would strongly recommend that. But we just have to remind them that you have the power to make your decisions, and we're here to support you in that and in your right to do that. Whether or not it's something that we agree with, every patient has the right to make their own decisions.
That's great. Thank you.
And of course, if it comes to something where we feel like it is endangering the baby, that's something where we would get like social work involved just to help kind of feel out the situation, because we do, obviously the babies can't speak for themselves and the parents do have a right to make decisions for their child. But if we feel like it's a situation where it's we need maybe some other insight, we can always reach out to our social work and have them be a
Perfect.
part of the team.
We have 2 questions in the chat. What is your schedule like on night shift? And what is the boards?
So schedule on night shift.
No, I think we
Like I
kind of
said,
went over that a
is
little
it-
bit, but it just kind of review this. I
yeah,
think
I
some
was in
people
time
came
to
in a little
review.
later.
So yeah, I start my night at 7 p.m. And yeah, usually just get started with a report. Usually the beginning of the night's pretty busy with assessments, meditations, just a lot of different things, getting to know my patient. I typically take my lunch break around 2 in the morning. And usually my lunch break is more of a power nap. And then, yeah, I'm done at 7:30 in the morning. Lord willing, sometimes I have to stay later to finish some stuff, but
So
yeah,
you get a
it's a pretty
30-minute lunch or
typical.
an hour-long lunch?
I did a 30-minute lunch. You actually, because it is a 12-hour shift, can have 2 30-minute breaks, but you can also choose to waive one of your breaks and just get paid for it instead. So that's what I've chosen, but I would have the option to take 2.
What does the rest of your day look like since you work 3, so you said 3 days a week, so 12-hour shifts, sometimes longer, and then you have 4 days off. So I can see the appeal there, but how does the rest of your week look, and how do you operate during the day? When do you sleep? How does, and do you like it, right? Do you want to move into the day shift at some point?
I like the night shift better because it is, for one thing, it's much quieter. During the day, it is super busy because you have lots of doctors, social work, birth certificate, lots of people on the unit. So it's just much busier. Plus, you're constantly like discharging and admitting. So that turnover is really fast during the day shift. I like the night because I get the chance to just interact more with my patients. It's just quieter. There's no visitors. Obviously now with COVID, there's definitely no visitors. But it's just a chance for me to be able to really kind of work one-on-one. So I like the pace of night shift better. As far as sleeping goes, so before I start my first night, I usually will try and sleep in as much as I can. And then I'll take probably like a 3-hour nap in the afternoon before I go into work. And then after I worked my last night, I get off and I crash immediately. And I'll just sleep as long as I can. Sometimes it may be till like 2 o'clock, and then I might be laying down for another nap like at 6 or 7. So it just kind of varies. But then on my days off, I do flip back to a normal schedule. So I'll go to bed like normal and be up during the day. But I do take lots of naps. So
I love a good nap, so I highly approve of that. Okay,
yeah.
we are going to move on to talking about grit. So, and then what motivates you, or and what do you do when you are having a hard day and you do want to give up?
For me, I take a lot of pride in my work, and patient satisfaction is a big motivator for me. I want to treat someone like how I would want to be treated if the roles were reversed. So obviously my first goal is to make sure that both the mom and the baby are medically stable. Beyond that, I want to make sure that they feel informed, they feel heard, and they feel cared for. And that doesn't mean that I can resolve every problem they have. Some people come in and I've literally had patients before expect the hospital to be like a hotel. And it doesn't always work out that way, but I want to do my best to resolve what problems I can, or at least make sure that I acknowledge that they're feeling that way. Um, as far as when I want to give up, usually the first thing that comes to mind is I tell myself it's only 12 hours and that I can make it. So, or it's only 10 hours at that point, whatever, however much time is left. Other than that, I usually reach out to my supervisor and my fellow nurses. I'm really fortunate that I worked with a great team of support who will step in and just help carry the burden, whatever that may be. Whether it's someone who's medically unstable and we're having to do emergency measures to try and stabilize them, or if it's someone who's just very demanding and difficult to deal with. We have a phrase that we'll use, we'll say that we share the love. And that means if we have someone who's just really difficult to deal with, they will get a different nurse every single shift because one shift is all you can handle. So we will share the love, which is a huge blessing because after you do one night, it's really hard to come back and do another night and have the same patience to deal with someone who is really difficult. And for me, I rely on my faith and prayer. That's just another element that I lean towards.
Thank you. What was your hardest professional obstacle to overcome? And then can you give an example of a time in your life when you had to show grit?
Yeah. So surprisingly, my hardest obstacle is not something medical. It is dealing with people. If you ask any nurse, she can probably tell you one specific patient who just sits in her mind as just being someone who is really either is a scenario that was really tough to deal with or a patient who was. For me, I can remember the room number, I can remember her name, and it will stick with me probably forever. She was one who had a reputation of being really difficult, not only on our unit, but other units. And we started out the night okay. I knew she was kind of a little bit rough, and probably about halfway through, she flipped a 180. She became super manipulative, very verbally abusive towards me. She was yelling, cursing at me, telling me what a terrible nurse I was. And I'm trying to stay calm and just still trying to treat her with kindness because a lot of times my go-to is just to try and win people over with kindness. And it just wasn't working. Things were escalating, her yelling. I mean, you could hear it through the whole hallway. And honestly, I stood in the room and I just kept taking it, trying to find a resolution. And just wasn't working. Honestly, I ended up in tears from probably 3 in the morning till 7 in the morning at my nurse's station, just because it was so emotionally overwhelming. Trying to figure out how to like calm this lady down and deal with her. And unfortunately that night I didn't quite have the support I usually do with my upper chain of command, my supervisors and stuff. And so I kind of just felt really alone in dealing with her. And I didn't want to subject my coworkers to going into the room to try and deal with her either, because she was just being so hostile. And we ended up actually having a staff meeting about this lady because it was such an issue on our unit. And I learned some very hard and valuable lessons. The first was that I can't fix everyone. And some people have some emotional and mental baggage that has been with them for years, and I'm not going to fix that in a 12-hour shift, and we're not going to fix it in their stay. So I have to let that go. There's just some people that we just won't be able to fix in that way. Another was that I have to protect myself. I can't just be taking that abuse like that. So I learned just some key phrases, like I can say, hey, when you calm down, I'll come back and talk to you. And it's okay for me to walk out of the room, even if she's still yelling.
Yeah.
I had to learn that. I had to learn that, let's see, what was I gonna say? I'm not neglecting my patient by walking out in that situation, which is what I felt like I was gonna be doing if I did the night before. I felt like that I was abandoning her because we hadn't resolved anything and she's still upset. but it's okay to be able to step out and say, no, when you are gonna talk like an adult to me, then
Yeah, setting
I can come
boundaries,
back.
right?
Yeah.
Yeah,
Yep.
that's
And that was
great.
something, yeah, we definitely needed to set better boundaries with her. And that was something that even our management was like, we handled her the wrong way. And so, yeah, dealing with people's definitely been a learning curve, because people come in with a whole history that I don't know. And sometimes
Yeah,
people aren't reasonable. And
yeah,
so you
that
just
makes
have to
sense.
learn how to deal with that. As far as the time showing grit, so when I think of grit, I think of like courage and perseverance. The time that came to mind is actually when I got into nursing school. It was February. I was back here in California. I had applied to start in the fall at Mid America. And they called me and they said, hey, we have a spot open a semester early if you want to take it. And I was like, great. Found out that was meant classes started a week later.
Oh,
And so
wow.
I literally had to like pack up my life, pack up my car, move back to Kansas, find a place to live, figure out like how I was going to pay for school, get ready to start classes. And it was in a city in Kansas where I didn't know anyone, which of course was scary. I had
Yeah.
some family a couple hours away. Not to mention that first week there, I got in a car accident and a
Oh,
hit and run.
no.
So it was just very overwhelming. And definitely just, it was a challenge getting started. And then not to mention, it was just a hard year of studies, basically consistently just taking in a whole ton of information, which you normally do in maybe 3 or 4 years, doing in 1 year. Um, and yeah, it was just out of my comfort zone. But the opportunity presented itself, and I knew I had to take it, and I'm glad I did. It got me working sooner, being able to pay off loans, and just, yeah, bumped everything up a semester early.
Thank you for sharing. That's great. So, oh, here's a picture of you. You want to tell a little bit about your whole life?
Yeah. So the picture on the left, this is pretty typical what I look like at work now. Obviously, we have much more PPE. So just wearing N95 mask, eye protection. So that's pretty typical what I look like in a shift. The second picture I just put up because it is the life of a night shift nurse. My husband actually snapped this after I got off work one morning. So tired that I fell asleep sitting up. And but yeah, you just sleep
And
random
you
hours of the
stole that
day.
cat, right?
You're not supposed to tell. Yes, this is our cat Oliver. We claim
You
him as
didn't steal it.
ours. We think our neighbor was the first one who kind of rescued him, but he has chosen us, so we are claiming him, and he's a
He
great
goes back
sleeping
and forth
buddy.
between the two and has now chosen
He
you
does.
guys as the
He
final
does.
home.
Yes. So he's a great sleeping buddy. And then I put up the other two pictures, just my husband and I. At the beach, and he took me backpacking for the first time this summer. And that's the beauty I love with being a nurse is my schedule is pretty flexible. So I just have my 3 days a week, but I can also, the hospital never closes, so I can trade shifts with someone, and just kind of cluster my days to get a longer vacation time off. So there's just a lot of flexibility there, which I love.
That's great. All right. And what life lessons has your work taught you? We talked a little bit about that. Where do you see yourself in 10 years? And the last question I'll go would be advice for our students. So I'm going to stop sharing. I can go back to this one and then let you check it out, and we can kind of wrap it
Yeah.
up and have some question Q&A time.
Okay, sounds good. So real quick, a couple just like practical, I would say like skills, life lessons I've learned just with nursing is time management. That is something that is one of those things they tell you that you'll need as a nurse. They can't teach it to you in school. You just have to learn that on the job. And that's been just a great skill that I have learned. It's taken time to figure it out, but that's one. Another is flexibility. I never know what my assignment's going to be going into the night. And whether we're dealing with short staffing, difficult patients, medically unstable patients, so just having the flexibility to embrace whatever I'm going to encounter has been a good lesson too. It's also just opened my eyes a lot to the world around me. I've interacted with many more languages, cultures, lifestyles, family dynamics that I probably wouldn't deal with in my own personal life as much or encounter quite as much. So, and for some reason, I'm really thankful. I've just been able to easily provide just that equal care among all my patients. I'm able to just, whatever maybe differences we have as far as beliefs or lifestyles, I can set those aside and just focus on what their needs are now. And that's been a huge blessing that I haven't really had to encounter just that difficulty in conflicting beliefs as much. I'm there to do a job and make sure that you're stable and cared for, and been able to do that.
Great.
Let's see. Honestly, I probably see myself in 10 years at the same place I am. I love my hospital, my team. Honestly, having a great team and management is major in nursing. From the moment I started, I've had other nurses just take me under their wing and be able to kind of just help me along the way. I could stop them in the middle of whatever and ask them a question, and they would stop what they're doing and come and help me. And so in exchange, I've been able now to do that with some of our newer nurses. And so I just really love that. I will always stay in the OB field. I love working with babies or moms, whether that transitions to maybe doing more NICU or in the nursery or things like that, who knows, but I'll probably always stay in the field that I'm in.
Awesome. Thank you. And then do you have any advice for our students?
Yeah, my advice would be that it's okay to get into a career and decide you want to make a change later on. My whole nursing cohort, all of my students in my class with me were all people who were in previous careers. We had people who were accountants, teachers. We even had one who was a pastor. We had paramedics who were all later in life looking to change and become nurses. And several now are either nurse practitioners or other nurses. So don't put too much pressure on yourself to figure it out now. Find something you're interested in, head down that path, get a job in it or get experience somehow, and then just go from there.
What advice? So if we have students here who are like, I want to be a nurse, I know it, I'm in high school, what would you recommend for them to do to start pursuing the nursing path now before college?
Oh, that's a good question. You could do like, if you're interested in just kind of that emergency side, you could do the EMT class. I think, I'm trying to remember, you might have to be 18 to do that. I'm trying to think while in high school, but even like volunteering at a care home.
Oh, that's a good idea.
So yeah, just getting volunteers. I know at our hospital, at least pre-COVID, like we would have people who are toddlers who would come and hold our NICU babies. Because sometimes they're just so fussy that we can't always just sit there and hold them. And so just even getting your foot in the door there. Yeah, I know when you're in nursing school, we have externs on our floor who come and work with the hope of being able to transition to a job once they graduate. But as far as like while you're still in high school, yeah, I would probably look for more volunteer jobs or look into like a EMT class.
Awesome. We offer at our school, we have a career technical education and we have a nursing pathway.
Cool.
I don't know, is anybody in the nursing pathway for our CTE program on this chat? No. So if you are in this chat and you are interested in joining the nursing program, it is a 1-year program. It's very intensive. It's 4 days a week, but you do come out with your nurse's assistant certification.
Oh, cool.
So
yeah, that's CNA.
Yeah, your CNA. Yes, exactly. But you do have to finish. You have to turn 18, so you at some point during the program, so you can get that because it builds up to it. So, all right. Well, we just have a little bit of time left. Thank you so much, Alexa. Before we close out, does anybody have any questions that we didn't cover about the life of a postpartum nurse? One question was, how do you cope and do you get emotional when you have a patient who passes away? And how often does that happen? Very frequently? Or is it more of a rare occurrence?
So as far as people passing away, it's not as common on our floor, although we do have babies that pass away. and that can be very emotional. Yeah, I just had one a couple months ago. Baby was born full term. There wasn't any reason baby should have passed away. And I had just come on shift and the mom was up in our NICU saying goodbye to her baby. And I had to go and get her. And so that definitely is emotional. We try to not, with babies that are what we call demises, where they passed away, sometimes they will come onto our floor. We usually try to either keep them in labor and delivery because we do have a lot of crying babies on our floor. So that can definitely be a trigger for a mom who's just lost her baby. So I would say we don't have it quite as much, but I definitely have had my share of babies who have passed away. And that can definitely be emotional. It's I kind of just take each case one by one. Some moms need someone there holding their hand, hugging them, crying with them. Some moms just want to kind of be left alone and just be left just her and the dad. And so I kind of just gauge on what they need. I'll usually tell a mom like, hey, if I'm in here and it's too overwhelming, you need me to step out, I said, you just nod at me or just motion for the door and I'll step out and give you guys some time. So I kind of just try and gauge what each individual needs. But yeah, it can be definitely very emotional. And yeah, we've had some moms just tragically who have lost their lives. And that's really hard when you have a dad who now has a newborn baby and the mom is gone. And we had one over Christmas. We actually sponsored him. He had 5 kids and the mom had passed away in our ICU. And so we sponsored them and bought them Christmas gifts to support his family, because that's a hard thing to have a new baby and not have your partner with you.
Yeah. Thank you for sharing.
Mhm.
Does anybody else have any questions for Alexa before we call it a day? And by the way, just to clarify, we do have the same last name. Alexa is my cousin's wife and my cousin.
I was gonna say, how do you say that? Cousin? Yeah.
Cousin-in-law. Yeah. And he will be he'll be giving a career chat tomorrow for sales and marketing. So come on back at 10 a.m. for that. Oh, the question of what the boards were, Isabel.
Oh yeah.
Can you wrap it up? We'll wrap it up with that question. Yes.
Yeah, so when I say the boards, I'm talking about the NCLEX, which is the national exam that you have to take in order to be licensed as a registered nurse. So it's just one test. Once you pass that, you never have to take it again, thank goodness, because it is a stressful test. And after that, then just every 2 years, you have to provide continuing education credits. So I have to submit 30 credits every 2 years to the California State Board of Nursing to show that I am continuing to stay up to date with my education, basically.
Does the hospital provide those credits for you?
It does. We have our skills labs that we do every year, which is specific to my unit, and we'll get a couple credits for those. Also doing BLS CPR, that provides some credits. I'm also certified in NRP, which is neonatal resuscitation, which is basically CPR for babies. That provides, I think, 11 credits. So yeah, I can get a lot of them through my work. There's also, you can purchase like a program where you just read a bunch of articles, and sometimes it has a test afterwards, and that'll provide you with the credits that you need. So there's a lot of different ways, and it doesn't have to be specific to whatever area of nursing you're in. It just has to be some type of education.
Okay. Alexa, thank you so much. We really appreciate you coming and giving us so much helpful information. I hope that students, you guys learned a little bit about the medical field, and it might help you guys kind of fine tune and pursue what you want to be when you guys finish high school. Just a reminder, one more time, in order to earn credit, and Alexa, if you want to head on out, we'll let you go. I'm just going to keep the rest here just for a little bit to give some more details. So you do need to sign in. So if you haven't signed in already, I know some people came in. Let me pull up that sign-in sheet one more time, and I'll copy and paste that and put it in the link. Again, to earn credit, you must complete a career notes page and reflection that your teacher can make a copy of digitally or provide you a paper copy. You must attend 5 career chats in order to earn 1 credit, and you can earn up to 5 credits if you attend 25 career chats, which we will be offering. We have 23 scheduled this week, and then we will have ongoing career chats throughout the rest of the school year and next school year. Does anybody have any questions about career exploration class? Or any of the career chats coming up this week? We have another career chat at 10 o'clock. I'm going to stop recording.